Kohaitep. Hello everyone. I'm Chief Wayne Christian. I've got some disturbing news for people, and I think pay attention because this is really important. As you now know and understand that the issue of COVID and the fourth wave is hitting us. And the numbers in our community, quite honestly, are alarming. Like we have 20 to 25 active COVID cases in our community. 20 to 25. This is a lot more than what hit us in the initial stages. The first wave and the second and third, this is the highest impact COVID has had in our community. And we've got about 20 to 25 people in isolation. Our Splatsin Health Services is working closely with Interior Health to inform individuals and to monitor and support those in self-isolation in our community. All the protocols we've used in the past, we continue to use. The Splatsin Health staff and staff as a whole, and myself and the Komipala are working hard at how do we put practices in place to protect the community as a whole. If you are experiencing a cold or flu-like symptoms, self-isolate in your bedroom and call Splatsin Health Services during the week between 8:30 and 4:30 at 250-838-9538. Again, during the week, if you're experiencing any cold or flu-like symptoms, call the health center, 250-838-9538. And after hours, you can call HealthLink BC at 811. Again, after hours and on weekends, HealthLink BC 811. It's really important if you are experiencing symptoms and looking at those kinds of issues, contact the health, whether it's the Splatsin Health Center and the staff there, or whether it's HealthLink BC. We must continue with preventative measures. You know, I've been saying this since the COVID struck, and I've always said that it is not COVID that moves around, it's our people that move around. And when our people are out there moving around in public, interacting, whether it's the local town here in Enderby or in the town of Vernon where you do shopping and all kinds of things, the mall, whatever, it's that you're moving around in the public. And COVID doesn't move around, it's the people like yourself that do. So you got to pay attention. So in public, wear a mask, you know. If you don't have masks, let the health center know. Get masks is really important. Wear a mask in public. Sanitize your hands. And keep at least 6 feet away from people, that physical distancing. It's really important. At home, wash your hands. Sanitize surfaces, and any gathering should be only with the people in your household. And if you're ordered to self-isolate, you must stay at home in your bedroom for at least 14 days, because the incubation period for this COVID virus is between 10 to 14 days that remains active. And that's when it's the most dangerous, when people can even not show symptoms and still pass it around. That's the issue for self-isolation, if people have come in contact with people that are positive. So really important, practice preventative measures. Wear a mask, wash your hands, physically distance. Only gather with people in your home, and it's really important we do those kinds of things. And all visitors to our buildings here are by appointment only. Staff continue to work from their offices, but with safety measures in place such as contact tracing, masks, and hand sanitation. So any enclosed gatherings where we are together in enclosed spaces, we put on masks, and I've seen that all over the place, different parts of things that I've been involved with is people are wearing masks, and I think mask up. The biggest protection from COVID-19 is vaccination. Vaccination. This fourth wave that's hitting us is hitting those that are not vaccinated. They've made personal choices, and those choices could cause their death, actually. We have to be honest and blunt about this. People are making a choice when you're getting unvaccinated, whether you live or die. And I think it's important to understand that. It's really that choice that you have a choice, you're making that choice, but it's those around you, children and elders that you interact with in your family, that you could potentially pass it on to. They have no choice. By your actual being unvaccinated, you expose them potentially to the new variants that are emerging, Delta, and the variants out of Delta. As this continues to grow, it'll continue to mutate. So vaccination. You can visit the Government of BC's online booking system or call 1-833-838-2323 to book your vaccination appointment. There are also drop-in clinics available. I've seen them here locally in Enderby at the center, the elder center they have downtown. I've seen lineups there. I've seen people getting vaccinated, those drop-in clinics. So those are important. If you're making that choice, it's there. You can also get online, and if you have access to online, and get book appointments that way. Also contact our health center if you have any other questions. If you are hesitant for any reason, and it could be your own personal health, you're concerned about it, in terms of your health conditions, etc., talk to your doctor if you have a doctor, or talk to the Splatsin Health Services and speak with one of our registered nurses. You can call them at 250-838-9538 on weekdays between 8:30 and 4:30 p.m. There are also online resources available, virtual doctors. There's a number of things that have arisen out of this COVID that people can get access by calling, at any time, and getting access to a doctor vis-a-vis a phone and an online appointment as well. The data is really clear that fully vaccinated individuals may not get seriously sick if COVID or the Delta variant is contracted. Over 90% of the hospitalizations right now are people that are not vaccinated, unvaccinated. 90%, so 9 out of every 10 that you hear about people are hospitalized, they're unvaccinated. And again, like I said, there's very serious the way this attacks them, attacks their systems. And so it's really, really important people understand that. Vaccination is the biggest preventative cure that can be done. And even if you are vaccinated, there's no guarantee you may not contract COVID. And I think that's just the reality, but it lessens the hospitalizations, lessens the possibility of you actually dying. So it is, I think we've got to be really clear about that. I think there's lots of misinformation. People are surfing the net and surfing all these sort of conspiracy things that they're, the biggest one is that they put things in the vaccine to trace you and follow you around, and I just laugh at that, because if you own a cell phone, they can follow you now by that vis-a-vis that cell phone. If you have a social insurance number, if you have a banking information, all of that stuff, if you talk about being tracked, we have so much data that we've given, quote, to government, your driver's license. They can track you, your resident. So, if you're thinking that that's some of the things you've heard, I think that you really need to think about you're making a choice whether you live or whether you die by vaccination. That's the bottom line. But the unfortunate part, if you choose not to vaccinate those that you live with, whether they're children or elders, you're making that choice for them. And understand that. That's what you're doing. So I think you have to, even as young people, you're making that choice. If you're not getting vaccinated, you're impacting your parents, your grandparents, your nieces and nephews if you don't get vaccinated, because you could pass it on within your family and your whole family could be impacted. So think about that. Think about what you need to do. So stay tuned. We're going to be doing more updates. Just this morning we had a Secwepemc Chiefs call and our Secwepemc Health Caucus around a mandated vaccination. All the communities are being impacted and it's very serious. So we're looking at ways and means of looking after and protecting our people. It's a big issue, and so how do we make sure that people can get access to vaccination? And we're looking at other different strategies that we're going to be doing as Secwepemc and getting messaging out to our people. Whether you're on reserve or off reserve, it doesn't matter. Like I said, COVID does not travel, people do. And you have to really understand that. So mask up, wash your hands, use sanitizer, keep your distance from people in public. Because you still have to shop for food, you still have to do things, go to the bank, all of those kinds of things. You still need to do that, but you got to wear a mask when you're in public. So stay tuned, we'll be bringing another message shortly, and be safe. Make a choice to live.